The Deep End Clinical Research Network cluster consists of 9 GP practices in socio-economically deprived areas of Sheffield with ethnically diverse populations. The Deep End Patient and Public Involvement Group is made up of patients from these practices. They help primary care researchers to design and deliver research which is inclusive by design.
Language barrier is another one, and that's more to do with language, maybe about jargon used by researchers.
What we experience, we don't want other people to have the same experience. So for that, you need to make a stand, you need to make a change.
My interest in this is to always advocate that everybody in health research should be treated equally. Hence, my reason of pointing out that this group has done well, but we can still do better. There are many minoritized groups out there. The Roma group, the Chinese group, and so on. Why are they not part of us yet?
Cultural barriers where people, due to cultural challenges they have, that they don't feel that their voice is relevant, it has value, and that health research is to do with the professionals, researchers, experts, academics. And I'm not just talking about Pakistan community, I'm talking about underrepresented communities, working class communities that don't know that health research is important and that they should get involved.
I don't like to put a label on everybody because we were labelled and we're still labelled.
Against inequalities. I live in Birmingham, which is a poor area. We've got the highest levels of pollution, highest in Europe, not just Sheffield. We've got the highest incidence of children with asthma and adults with lung disease.
Without research, you can advance. We need research. I'm just glad I've got the opportunity to be out and give my views and things.
Thank you.
This type of information really needs to be up there in different languages so people can get involved in health research. And it's only through my personal connections with Kate, one of the researchers, who invited me along to talk about post-COVID symptoms. I thought, oh wow, this sounds really interesting. And because she made me aware that there's very little in terms of people from my community, from the Pakistani community, I thought, well, why? Why is that?
My motto is, if I can help somebody as I pass along, then my living is not in vain. And that's what I try to live by.
And I think by being representative of your community is one of the ways that we can push through those barriers of racism or inequalities. We've got to be there. We've got to be like we are now, sat together, having this conversation, rather than in our private home settings just complaining about it. We've got to be there.
I think my motivation has been primarily personal. Like others, I come from an ethnic group which is disadvantaged in terms of health. I come from an area which is disadvantaged in terms of health, and I've personally suffered from chronic health problems for over 20 years. So kind of a personal stake in kind of coming to the PPI groups and giving kind of lived experience of the kind of things, kind of issues that could come up in research. So it's given me the opportunity to do that. But it's also given me an opportunity to develop as well. So I'm also thinking about maybe doing other things, maybe running a community group within my locality, things like that. So it's given me a bit of confidence and kind of thought to look at those things as well, to try and help tackle those inequalities.
I've seen a lot of injustice and inequality, and that's why I do it, and I get a buzz out of it, and we're a lovely group. We've never ever had any unpleasantness between us ever, have we? We bond. even though we're all different, we can agree to differ. We might challenge the statement, but another person. And I just think it's wonderful. But like Jude, I think we've got a long way to go.
We all bring something different to the table, as well as I'm sure we all learn something as well every time we come, which is healthy. We all need to learn new things, and it also puts us on the radar, the everyday person on the radar of health researchers, and what we can add value to what they are looking for, and give our representation of our feelings and like-minded people, really.
But in terms of how they interact with us and try and get that exchange of information, I felt very comfortable.
They realized that they were experts in their field. We were experts with our lived experience, and they respect it. All of us here, we have lived experience. Nobody can talk of your field or talk of your lived experience more than you, and you're an expert in that. So there's that. What really makes them attractive is that they have that humility. We recognize their expertise. We too have our lived experience. We recognize that, and we come as a parallel bond and work well together.
I attend a lot of meetings, and sometimes they can be patronising, and sometimes they can be a bit aggressive. There's never ever been any unpleasantness in this group, and we all can admit our strengths, and we all can admit our weaknesses, and we all help each other, and we'll all help to explain if somebody doesn't understand. But the bottom line is we all want the same thing, and that's good. And it's wonderful that all these GPs are going that extra mile for inequality, especially in these dark times.
You know, what do you speak about? But mine, it was good because it was during COVID and it wasn't face to face. So most of all our meetings were Zoom meetings. So for me, it wasn't that bad, you know, like joining in.
And as time moves on, and you'd expect that things should change, but the core of it has never changed. And I think that's why some of the agenda this morning, you get a little bit rattled or concerned or pensive because you don't want the equilibrium to change too much, because as it stands, it sort of works. Yes, we need younger members, we need male members, we need buy-in from other people, but be careful because you don't want to rock it too much. Gentle touches, really, because like I said, we're all the same, but we're all very different as well.
I like the idea we discussed earlier about having the core members of the PPI group. I think that works, so it sort of limits the amount of change too fast.
Yeah.
So we've got these core permanent members who are very committed, very passionate about getting involved in health research, and then having your peripheral members who get a taster of what it is like to be part of a PPI group. And I think one of the ways that that can be achieved is just through our natural interactions in our community. So Linda, I'm sure you know a whole network of people. Carol, you do as well. Alan, you do. Jude, you do. And it's about tapping into those natural interactions we have. And I know Taslim is like a guru in her community of the amount of people she knows.
Yeah.
But it's about naturally inviting and spreading the word of whatever project we're working on. And I like the idea of partnerships. That's a word that we spoke about a few times, to try and speak to people from disadvantaged communities that don't have these conversations, don't know about health research,